G'day, everyone. It's Jamie Johns here. I'm the CEO of Sky Accountants. I'm here today with Ashley Carmichael, who's one of our senior client managers. How are you today, Ash?
I'm really good. How are you?
Going well, thanks, Ash. And our industry is busy as ever, isn't it, at the moment?
Yeah, it keeps us off the streets.
Sure does. Sure does. It'll be a problem if it didn't. Ash, today's podcast in this edition, we're going to talk about something that you have specialised in over the years, and that being the health industry. Um, how long have you pondered around this industry, Ash, and how did you get into it in the first place?
Oh, look, accountants, we work with all sorts of different clients.
Yeah.
And, through that process, you start to work with one client and,
Mm,
um, people tend to gravitate towards certain types of businesses or certain industries, and the health
mm,
sector is really one
mm,
that I have gravitated towards. I really like it.
mm.
Um,
And of
when
course, you get referrals from similar
mm,
type clients too, don't you? Then.
and you build up a bit of industry knowledge, and
Yeah.
it just sort of snowballs. And
Mm.
so yes, we work with quite a number of businesses in the health space.
Mm. So in that space, Ash, could you just rule off a few in that sector if you like that would come top of mind?
Yeah, look, it's really a broad
Hmm.
sector. It's there's a lot to it, and depends on where you
Yeah.
draw the lines. But
Yeah.
it includes things like doctors, so GPs, surgeons,
Yes.
um, the dental industry, so not just dentists, but dental prosthesis, etc.
Oh yeah.
Physios,
Mm. Mm.
OTs, speech therapy. Uh,
Yeah.
the list goes on and
On
on.
and on. Yeah.
There's,
Yeah.
it's quite
Uh,
a broad industry.
But obviously there's common issues or challenges that the health, those some of those ones that you mentioned, but also common issues that they all have, that I bet that you've seen over the years, being a professional advisor to them. And you could probably put a lot of those problems into the one bucket, which we'll discuss today, of course. But I noticed there, earlier we were talking about a classic book, called The E-Myth, by
Yeah.
Michael E. Gerber. And what does that sort of really outline? What's Gerber talking about there, Ash, and how would it apply to the health industry, do you think?
Yeah, look, it's a really famous sort of business or
Mm,
entrepreneurial book. It's written in something like, well, is it 86 or
I
something
think
like
the
that? It's
80s.
old.
Yeah.
And the idea from it, is this E-myth, and E-myth stands for entrepreneurial
Yes.
myth. And and it's this idea that he had that a lot of people decide that they're really good at what they do. You
Yeah.
know, they're an accountant like us. Funnily enough, our industry is quite susceptible to this
To
too.
the E-Myth.
But
Yeah.
they're good at what they do, and so they decide they're going to start a business and assume that it will be successful because they're good at what they do.
Because they're a good technician. Is
Good
that right?
technician.
Yeah. Yeah. Yeah.
And whilst they may be good at what they do, the
Hmm.
skills to be successful in business, as you know, Jamie, are
Mm.
quite different to the actual doing.
Yeah. And it's interesting, isn't it? Like people in the in the health sector that we're talking about, there's probably all sorts of reasons, but obviously people start their own business and they
Mm,
may be very good technician. But where do they sort of, how big is this industry, Ash, in Australia, for example? Maybe we can touch on
mm.
that
Oh, look,
and
it's
yeah.
massive,
Mm,
and getting bigger.
yeah.
Will continue to, I saw a statistic, I think it was from the census, the most recent census, that
Yeah.
15% of our population work in the health industry.
Yeah. That's a lot.
And
Yeah.
the sort of the increases in some of the professions within the industry have just grown exponentially.
It's a
Um,
it's interesting to say that because, like there's a lot of talk about, the demographics that we've
mm,
got going on in Australia, and not only that, Western countries, but someone showed me the other day, Ash, that it's like a wedge. So you've got
mm,
the older population at the top, and then we're not, apparently we're not having as many children, so it sort of dwindles down to that upside down
mm,
pyramid, if you like. And so, naturally, you know, older Australians, we're going to need healthcare. so,
mm,
so I can understand why this industry is growing and probably continue to grow,
mm.
for the foreseeable future.
Yeah,
Um,
and look, in many respects, it's kind of recession proof too. You may
mm,
not,
mm,
for example, you may not necessarily love going to see a physio, but if you've got a
yeah,
problem with your shoulder, you're going to go anyway,
yeah,
because they'll help you with it. So,
yeah. Well,
so
to get
it's a really, really big industry.
big industry, yeah, and
Mm.
in your experience, Ash, then, and sort of, referring back to the E myth of the entrepreneurial myth, can that be overcome? Do you think like is that
Yeah, well,
mm,
look, it is a prevalent thing in the industry, and it's
mm,
sort of twofold. It's a big industry.
mm,
It's in terms of barriers to entry.
yes, yeah,
It is accessible, so people can start a small business in the industry,
yeah.
and it's not like you need $1 million worth of
Oh, I
equipment
see.
to
So the
get
barriers of
started.
entry, yeah, that makes sense.
So, that because it's a big industry, because there are fairly low barriers to entry, you
Yeah,
do get a lot of people who have that sort of
mm,
idea to start a business. And
mm,
unfortunately, whilst these people are often really highly trained in what they do,
mm,
they've had zero education in finance and running a business, and so they sort of come
mm,
to it as real novices. And
yeah,
the critical thing is that they recognize that they need a new skill set,
yes, yeah,
and they work out what the
yeah,
key things that they need to be doing are to
mm,
succeed, and work at that.
mm,
And so we've actually, you know, for today's podcast, sort of put together a bit of a hit list of 10 different areas.
mm,
Now, we don't
yeah,
have all the time in the world, and there's a hell of a lot in this. So, we'll be covering each of those at a really high level. But
yeah, yeah,
anyone who wants to know more can reach out to us.
and let us know. And for
Mm,
the benefit of the audience in this podcast, Ash, like you work with people who, are at the very beginning and starting out, and they might be a sole trader. But also, how far does that then go, Ash, in terms of, in the health sector of, say, larger businesses? Is there like group practices and sort of things? So what's the depth and the width that, in health that you'll cover just from a business
mm.
point of view? Does it start very small and it can go
Oh,
a lot
yeah.
bigger?
Yeah, look, some of these businesses can effectively start as a one person band.
Man, yes,
They can be very small,
yeah,
and depending on the approach,
yeah.
that will depend on whether they can go from being very small to something a bit bigger. But
To,
yeah, you
mm,
sort of we work with businesses along the whole sort of life cycle
life cycle.
of
Yeah,
beginning,
yeah.
um, developing,
Mm,
maturity, and then to the other end of the spectrum with those really ambitious businesses that really want to grow and put
yes.
together a really good size concern.
Yeah, because those
Yeah,
larger businesses, as they grow, obviously they'll probably need a management team and, financials and board
mm.
reporting and all those sort of things. And do you help people? Do you help those type of businesses with some of those type of things that we'll discuss?
Oh
Yeah,
yeah, yeah, and look at it can also be things like along the way, like doing mergers and acquisitions.
M&As as well.
Often, a
Yeah.
business will get to a certain point and
Mm-hmm.
acquiring other businesses is it,
Yeah.
seen as a
Yeah.
really viable way to continue to grow.
Yeah, it's good that you've got the knowledge and the capacity and the skills
Mm.
in that because, that's something that we might see more of in the health sector, Ash, perhaps in the forward where there's
Mm.
M&As and a bit of consolidation perhaps in the industry as well
Yeah, and that definitely is happening. Mm.
is happening as well. Yeah, yeah. No, interesting.
Yeah.
But look, let's look at perhaps what one of the first challenges that, the health sector would face. And I note there, you've mentioned to me before that it's just about um, having a good clinical knowledge or governance as well.
Mm.
What's the sort of challenges there, Ash, or fundamentals in this particular? If you can explain that sort of
Yeah.
barrier first.
Well, that's sort of 101 stuff, which is you're not going to do very well if
Hmm.
you're not good at what the business does. If you're not,
Yeah,
if you're a dentist and you're not very good at seeing to
yep,
people's teeth, you're not
yep,
going to go very far. So it's about, having,
yep,
you know, the expertise to do the work of the business. But
yeah,
beyond that, if
yep,
you want to grow, you need to be able to bring additional people in and leverage their talents,
yes,
um, which means that you need to have some governance in place to make sure. It's one thing for me to make sure that I'm doing quality work,
oh,
but it's
yes,
another thing to supervise a team, particularly when that includes more junior people, to
mm.
make sure that they're delivering on the quality promise.
And at a
Mm.
practical sense, how does that happen, Ash? That governance side of it? Do you
Well,
think?
you need to have some procedures in place and
Mm,
make sure that is. Like, it's hard, but it's not that hard. It's just around
yeah.
processes for supervision and mentoring.
Yes. Yeah.
Mm.
And I guess that oversight of educating the people that you're bringing on and making sure that they're following all the rules and regulations and
Mm.
what that particular sector requires in terms of the delivery of
Mm.
the services. So
Yeah.
we
So,
all
yeah. Fundamentally, it's not about just sort of hiring someone, putting them in a room and
yeah.
ignoring them and hoping for the best. You
Um,
need to supervise
that's right.
what they're
Which
doing and make sure that yeah,
they're,
it's
they're
not unique to that industry, but it's important in this
Nah, that's right.
industry.
Well, it's like we don't want to go to the dentist and have the wrong tooth pulled out.
Yeah, well, I've got a funny anecdote about an old friend of mine who
Yeah.
injured I think it was their Achilles tendon many, many years ago and was carted off to hospital, and the doctor almost operated on the wrong one, on the left, not the right.
Yeah, no, you're absolutely right. You do hear some horror stories, and I think I heard a story the other day that someone took their dog to the vet and the wrong leg was actually operated on and fixed. And then when they got the dog back, it was actually no, hang on a minute, it was the it was the wrong leg. That's a true story. So that governance, I think, you know what,
Mm,
that checklist, that government, which really leads to the next point, is
mm,
if you have a lack of systems, if you have a lack of governance, then you've probably got a lack of systems and procedures because
yeah.
a bit like the dog story, you're going to get it wrong because such a high volume of traffic in these industries as well. I'd say a lot of these, if you're in these industries, you're potentially going to be flat out. Is that correct?
Oh yeah, look, a
Yeah,
very busy industry. It's
yeah,
you know, and as you said, high volume. You tend to see a lot of people in a day, and so
yeah,
systems and procedures is one of the things that we've listed as being a critical success factor. And
yeah.
what that's about is that you
Mm,
can't grow and succeed without achieving or getting some leverage. You can't
yeah,
you can't have your dirty little mitts all over every aspect of the business.
that's right. Yeah, and the old saying is you can't micromanage people either
Mm,
when you're trying
that's
to
right,
grow.
yeah.
Yeah,
And
so
so you need to be able to delegate tasks or work to people and have
Yeah.
the confidence that they'll be done to a high standard. And
Yeah.
part of that is about being systemized and documented so that people
Mm.
do have that real clarity around, how to do that task right. And that can be,
Mm.
the clinical work, but it can also be the administrative work or,
Yes.
HR
Yeah.
function, finance function. It goes
Mm.
across the whole business.
And does IT come a lot into that in the
Yeah.
health sector these days, Ash, particularly even from, the booking the appointment stage, right through to
Mm.
the, the client life cycle, if you like, where, there's a follow-up appointment made or something once, and, a consultation is done. But that would be a big factor in the success of that these days, wouldn't it?
Yeah, that's right. A big
Mm.
part of systems and procedures is having, not just
Mm.
clearly defined systems, but systems that are efficient and that work and leverage the right tools so
Yeah.
that you can, operate
Yeah.
without mistakes
The
efficiently. And,
limit of mistakes. Yeah.
and so,
Actually,
yeah, it's definitely an industry where
mm,
technology is sort of really
mm,
growing in its role. If you go back, you don't have to go that far back where a lot of health businesses had fairly basic technology.
yeah.
But now, they're really relying on those tools to
Yeah.
help manage.
No, I know, last time I went to a health professional and I hadn't been to the business before, there was definitely a
Mm,
myriad of checklist. Well, I think there was 2 or 3 pages of things I just had to fill out and
mm,
coming back to that governance thing as well, So Actually, we look after people's financial affairs, right?
mm,
There's, we're probably second on the ladder, but something that obviously comes extremely important is people's health matters. It's not things you want to get wrong, and it definitely reminds me. Last time as at a health professional, I think there was literally 2 pages of checklist that I had to fill out. So you miss one thing, you can trip over.
yeah.
So it's funny we talk about it because there was a few years ago I read a book actually for listeners called the Checklist Manifesto. And our long story short, it was written by a doctor in the US. I think he worked at Johns Hopkins Hospital there, and the statistics on the perhaps faults or hiccups with patients was quite high.
Mm,
So they brought him in as a consultant to reduce, the problems and even patient deaths, known to be caused by the
mm,
hospital and lawsuits and all sorts of things. So they brought this chap in and basically put in systems, procedures, and just a massive amount of checklists. And it's all documented in the book, the checklist manifesto. And sure enough, the errors and the deaths all
mm,
started dropping because they had system
mm.
procedures, they had checklists. So it's certainly
Yeah.
pertinent to have these things.
Yeah.
And
You can be really good, but if you're operating off
mm,
memory alone, it's a little bit
yeah,
risky.
and just touch on a little bit, Ash. The third point here that we talk about is how important is client service, and what, in the health industry, what is good client service that you see?
Mm. Yeah, look, it's an interesting area because
Mm,
what we mean by client service in this space is just what is the experience
mm,
of the client,
yeah.
using that term broadly. Some people might say patient, customer, what have you.
Hmm.
Um, but it's what's their experience like and how do they feel it?
How they were treated.
And so,
Yeah. Mm,
you can have lots of examples of people getting the right kind of treatment. For
hmm.
example, they've been treated appropriately for
Yeah.
the condition they're presented with, but
Yeah.
the client service can be really wanting and leave quite a bad taste in the mouth.
Yeah.
Um, and anecdotally, that sort of the old bedside manner can be an issue. And so, these businesses are like any business. You need customers.
Yeah. And
And
the support staff too, I think, Ash, with that client service. So from when you first get on the phone or you jump on the website to make the appointment, right through to, your first experience with the health professional and their approach. And my wife's worked in the health industry for 20 years, as an intensive care nurse. And so, you get to see these different types of level of service. But as you said, the bedside manner, the post-appointment follow-up and administration and that type of thing. So, the health businesses, they need to be very aware of, even we talk about monitoring that level of service, Ash, with net promoter score, um, type surveys. Now, we often see that across all different types of industries. But I think the best health professionals would have some type of way of monitoring the service levels of the clients, of
And
course.
it's actually really important because a lot of the time success is around retention in
Yes.
this industry. So say I go off to see a physio.
Mm-hmm.
Now, success for the physio is retention. They want
Coming back.
me to come back for a series of appointments so they can treat my condition fully and properly.
Yeah.
Right. But if on the first day that I attend, the service isn't that great, on the way
Yeah.
out the door, nobody books me in for my second, third, fourth, whatever appointment,
Yes.
I can quite easily drop off, or even go somewhere else.
Yeah.
So it's important that if they've got those good client service processes in place, they can get their retention rate up, and it's
Yeah.
good for me because I'm getting the right treatment. It's
Yes.
good for them because they can help me and they can make a profit in so doing.
That's right. And sort of coming back to that good service, like no one really, we mentioned there earlier, I think you might have said wait times, but, no one wants to sit there for an hour. They've come in, the business isn't run strategically very well in terms of the clientele. And, no one wants to sit there for an hour, do they, waiting for their appointment?
And look, sometimes it's unavoidable that, things crop up in a busy day, but other times it's just about organisation.
Being organised.
I
That's
can
right.
think of, one particular time having to see a doctor, and I was first cab off the rank, first appointment of the day. And,
You were.
it's,
Mm.
you know,
Yeah.
10 minutes past when the appointment should have
Yeah.
started, and a door swings open and somebody walks through and then goes into a room, and then another
Yeah.
5 minutes goes by and that same person emerges and calls my name. It was the doctor.
Yeah.
It was, the day hadn't even begun, and he was late, so
Running behind. Yeah, no, it is certainly about service levels and, just those things like wait times and follow-ups, like there's even follow-ups on appointments and what the outcome of those appointments was. So there's a lot of communication that needs to be dealt with efficiently in that sense. Yeah.
and that's a big part of that's around having good quality, well-trained support staff
Staff. Yeah.
who can sort of take responsibility for some of that sort of thing.
That's right, the admin, yeah. Which leads me to the next one. Is it been more difficult of late, and probably across all industries, but perhaps health in particular, is the recruitment?
Oh yeah.
Why is that difficult, Ash? And what's some of the best ways to overcome it? Do you think?
Yeah, look,
Like,
the labour market in the health industry is incredibly tight, has been
yeah.
for a good couple of years at least. And like, it's always tight, but
And is it because
it's
demands?
really tight.
Yeah.
And it's just reflective of the growing industry.
Yes. Yeah.
Essentially that there's more demand for the professionals than there are professionals to fill those jobs, and which means it's a really competitive space. It's hard to find good staff. The biggest mistake we see is people who kind of just give up and decide that they're not going to get new staff. What we think and what we see is that those who really work at their recruitment processes, notwithstanding the tight market, they can have some success. Not easy, but they really need to look at what activities they're doing to promote the business and get good applicants, and to be able to vet them and have a good hiring and onboarding process
system as well.
So it's, I was going to say, a reality of it is that there's limited capacity within most practices for this sort of thing, so they might or should look at how they can leverage their time, which is primarily through having a good relationship with a recruiter. But it's also about things like getting involved in university placements, so taking students in for their placements and trying to sort of cultivate future people who can come into the business as employees.
And just developing that network as well, like if there's existing, you've got existing team there or colleagues or peers, and often it's like who sometimes too, isn't it? So you sort of got to, you've got to sort of overcome the appointment challenge with a multi, solution type process, and continually promoting whether it's your website, business awards, all sorts of things that make you look like that you're a business that's attractive to work for, essentially. And
then that sort of leads into the next topic, which is HR, human resources. So once you've got the staff, you need to be able to manage them, from a compliance point of view. Do you pay them correctly in line with the awards, etc., things like that, but also do you have programs within the business that are around developing those staff and retaining them?
And part of that would be, I'd imagine, performance reviews, Ash, as well. People often leave, there's a lack of career path. Performance reviews aren't done.
Look, people need feedback. That's a big part of it. But particularly, I find in the health industry, the staff and younger staff more so, they want to develop their career. They want to, build on their skills. And so if you're not supporting them to grow as a professional, you're going to lose them.
You'll probably potentially lose them. That's right. So it's important for owners to understand that, isn't it? 100%. And I mean, if we sort of go through this process where we've started out on our own and we're building, when we've added team members to our health business, what are the some of the key things in terms of that performance management, Ash, that health professional or business owners need to be aware of? And it's easy to lack that business acumen in a financial sense, isn't there, as well?
Look, this is about knowing what are the drivers of the business. Fundamentally, it's a business. So, what drives the financial outcome? So, it's around having clarity around things like what activities drive referrals and new episodes into the business. Things like how many treatments each clinician needs to be seeing, say, on a weekly basis. And making sure that sort of thing is articulated well to the team, so that they know what their expectations are, and then sort of actually monitoring and managing that.
Yeah.
Mm.
So it's a bit like the recruitment, and it's all interlinked. But
Mm.
so in a sense, you want to be very clear on what the outcomes are
Mm.
of each person within the business, what their
Yeah,
outcomes are. Then you can measure their outcomes. And then, if you're not getting the outcomes you want, then you can coach them or help them and oversee and mentor them so that, they're hitting the KPIs that you want. Because I could imagine, Ash, if you weren't clear on that, it'd be very easy to hire someone, have their salaries hit the bottom line and not see them making any revenue, for the firm, for the business.
yeah, that's
So,
right.
yeah.
And particularly younger staff, fresh out of uni or whatnot, or that have, not previously worked in a private industry.
Mm,
Um, they don't necessarily understand the linkage to
yeah.
financial outcomes.
The
Mm.
drivers, yeah, the
Mm.
drivers to those
Mm.
outcomes. Yeah,
Mm.
yeah.
Yeah.
No, that's right. Yeah. But in turn,
Um,
you're right.
I was just going to say the other, number 7 on our list is scale, which is sort of
Hmm.
is interrelated to that, which is, you know,
Yeah.
businesses have costs, and
Yes.
those costs tend to be, particularly when you're starting out, quite fixed. It
Yeah.
might be the rent on your clinic. It could be
Yeah.
the support staff, or your reception staff, that kind
Yeah.
of stuff.
What would be the top in, the health industry, Ash? What would be the top two or three expenses that you would see with your clients?
Typically, wages, number one,
Wages. Yeah.
rent, number two.
There you go. Yeah.
And then, depending on what sort of business, probably equipment,
Yeah.
and materials.
Mm. So what?
Um,
So what's the driver for wages then? So in a typical health business, would that be the number of appointments that have held as an example?
yeah, look, you know,
Mm.
typically you're billing per appointment.
Oh
Uh,
yeah. Yeah.
and so,
Yeah.
at a very simplistic mathematical
Hmm.
basis, the more appointments that are held,
Yeah.
the more profitable. But,
Yeah. That's
what
right.
we see is basically if you can get enough um, clients coming in, so enough
Coming in.
referrals or new episodes coming into a business, then you can bring additional staff in to
Yes.
see those, and generate more revenue. And more revenue means that you can
Mm.
more easily cover your costs
Yeah.
and increase your bottom line profit.
Yeah.
I'm sort of talking very simplistic terms, but
No, that's right.
but
Yeah.
the scale, so the number or the revenue that's coming through this business based on the number of staff, professional staff,
Yeah.
is really what's going to drive your bottom line profit. It's
Yeah.
very hard to make a good profit with a small number of clinicians.
A small number of clinicians, yeah, the more that you've got, then you'll get more scalability or economies of scale,
Mm.
and your ability to sort of make a better bottom line enhances. I'd imagine that's sort of, I
Yeah.
think, what you're saying.
And there's
Yeah,
also, it gives the founder of the business the opportunity for a bit of freedom. If
yeah,
I'm the main person, if I take 2 weeks off for holidays, like the business essentially grinds to a halt.
yes, that's right. Yeah, it's
Whereas if you've got a team of people, then it's much less disruptive.
yeah. There's, certainly challenges to growing, but there's certainly some benefits if you can get it right. There's no doubt
Mm.
about that. Yeah.
Oh
What
yeah.
in terms of the financial management now, what are some of these sort of, in working with your clients, what are some of the key things that I know that you've worked on, Ash, in terms of that monthly financial management? What are some of the key things that you would work with your clients over the years?
Yeah, look, it tends to be an area that healthcare professionals have had really limited exposure to.
Yes.
Um,
Yeah.
and so it's one of those things they need to upskill and pretty quick.
Yes.
And so, a big part of that is to leverage professionals in that space.
in
So
that space. Yeah,
yeah,
don't try and be a specialist in everything. Bring in
mm,
someone who can understand their lane, understand the
yeah,
financial
and
side of
do
it.
that sort of, like, say having a busy, I don't know, say an OT for sake of argument,
Yes.
and they're sitting there at the computer trying to do bookkeeping that they don't really have a lot of confidence in doing, while there's people on their wait list not being seen.
Yes.
It's probably not a good
Use of their
use of their
time.
time,
Yeah.
right?
Yeah.
And so they need to surround themselves with the right support, but also,
Yeah.
through that, get, say, a good accountant who can help educate them and
Yes.
improve their knowledge in financial management. So, so
Yeah.
they can look at their numbers and understand the story that it's telling,
Yeah.
and be able to plan and make
Yeah.
good financial decisions.
Absolutely. And what I'm hearing there too is like just on the side there is learn what to delegate as well. So as the practice grows, you might have sort of been wearing all the hats in the early days, but it sounds to
Mm,
me like as the practice grows too, you've got to know what to delegate. So that might start with the admin side of it, the appointments, the internal bookkeeping, and so forth as you go, the actual seeing of the patients themselves. So it's important to understand, I guess, Ash, how to grow sustainably too. I would imagine, and financial management would come into that, particularly if it when
mm.
particularly Ash, when you're looking to hire your next clinician.
Yeah,
You
the
know,
good old one, can we afford to hire someone? uh,
yeah,
but it's, it really filters through every aspect of what you do, which is,
yeah.
if you
What?
want to have a successful business, you need to be looking at it through the lens of,
Yeah.
what will help us move forwards,
Mm,
what will help us grow the business, what will help us improve our profitability.
mm. And with
Uh,
some of the clients you've worked with, like, do you get them looking at their monthly profit and loss statement, for example?
Look, yeah, it's a prerequisite, to
Prerequisite.
know your numbers,
Yeah.
and it's, a lot
Yeah.
of business owners, particularly in the small business space, and not just in the healthcare industry, in all industries, they kind of just ignore it, and
Yes.
they manage on gut feel, which is really not great. You
Yeah.
need to arm yourself with real information, um,
Yeah.
so that you're managing it right, and be looking at it rather than just, sometimes you see a business, they'll get to the end of the year and they'll
Yeah.
see their P&L, profit and
Yeah.
loss,
uh,
and they'll be a bit disappointed. It's like, well,
Yeah.
because you weren't looking at that and tracking how the business was moving, you
Yeah.
couldn't take any corrective action.
Mm.
That, the opportunity to have changed the outcome has passed you by.
Yeah. That's right. And the other thing on that, Ash, too, is like it's important to sort of be commercial, isn't it? Because if you're still working in the practice, and let's just say hypothetically, the owner decided to step back,
Mm,
they really need to apply a commercial salary or wage to that person if they get to a point or a size where they step back and someone steps into their shoes. So I think it's important that we understand how hard the business is working,
mm.
versus how hard the individual is
The
working.
owner, yeah, yeah.
Yeah, so no, it's certainly
Mm,
interesting. Yeah, yeah.
mm.
And what about marketing? What are the key things in say the in the health industry with marketing? Are they a lot like every other business, Ash, or you'll often see advertisements for various health professionals, both in social media,
Mm.
sometimes print media, sometimes commercials as well.
Yeah, look,
Um, mm,
business is a business in this respect. Everyone needs customers,
yeah, that's right.
and
Yeah,
and the real aim of the game there is to have a consistent supply of quality customers.
customers. Yeah, yeah,
So people, that value what you do and that are prepared to pay a good price for that. And marketing plays an important role. You and I, both
yeah.
know a person in common who likes to talk about creating the garden that attracts the butterflies.
That's right.
And it's
Yeah.
a good analogy, really good analogy. We might
Yeah.
have to give him credit at some point, but
Yeah, that's right.
but you know, healthcare businesses need to invest in their marketing
Yeah.
and make sure that they're promoting their business to attract those
Yeah.
customers. Like, the worst thing in a business like this is that you've got a team of clinicians standing about the clinic doing
Oh,
sweet FA
yeah, 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 yeah.
because there's
Yep.
no customers or no clients to be seen.
That's right.
That's very costly for your bottom line.
Yeah. Standing around with like a paid audience, but
Mm,
yeah. And I
mm,
think that, the business owner, they need to be aware of how to make marketing collateral and,
mm,
and pinpoint, who their customers are and,
mm,
make sure that you create that collateral that then brings that type of customer into the practice that you want. So,
mm. And
yeah,
look, marketing tends to be one of those things. Some people tend to, have a natural flair for it or do it really well. Whereas others, it's just hard, that don't know where to start, don't have the time. And it's often one of those areas of the business, getting back to that idea about delegation.
yeah,
That could be one of the first ones that needs
yeah,
to be delegated, because it's, what we find with marketing is that unless it's done consistently, you lose momentum,
that's
and
right.
it's a losing battle.
Yeah, it's
Yeah.
important to put time aside for it to work. One of the things is put time aside, I think, Ash, to work on your business. So we might have
Mm.
come back to the outset, with the E-myth and
Yeah.
marketing's part of that process. And, I think always a good place to start is, even if you just allocate 1 hour a day or a certain amount of time in your calendar, particularly if you're a practice owner, so that you can look at these things. Because if you're sort of on the hamster's wheel, you're not going to make the time or the space to work on the practice. Yeah,
Yeah.
that's right. Yeah. Just in terms of the last point there, Ash, commerciality, perhaps if you can explain the challenges around that, of just being sort of commercial as a practice owner,
Mm.
to adopt a commercial approach.
Yeah,
What
look,
it, yeah,
it's an interesting one. And, a lot of people get into the industry because they genuinely want to make a difference. They want to help people.
help people. Yeah,
Uh,
yeah, yeah,
and sometimes they sort of, through um, sort of well-meaning things like universities or whatnot, they sort of get sent the wrong message that commerciality is a bit of a dirty word.
yeah, yeah. Making a profit.
Yeah.
Yeah, yeah,
And so it can be a bit of a fraught area. And, one of the things we really try and get across to the clients we work with is
yeah,
that the opposite is true, that it's really vitally important to be commercial in your practice.
yeah,
Um, and the idea there is that in order to be able to provide high quality care
yeah,
to a lot of people that you want to help in a sustainable way, is to be commercial. If you're not commercial, you're not going to last.
I'd imagine a big driver of that, Ash, is
Mm,
just sort of but depending on the health professional or sector, is just the time of
mm,
consultations. Like, there's got to be a happy balance where you deliver a professional service. But
mm,
at the same token, if you're taking too long to do every consultation and you're a very talkative person, and
mm.
the time could blow out, and
Well,
then
that's right. Yeah. Like, if I spend
mm,
90 minutes in a consultation that should take 20,
20 minutes, for example.
that's over servicing.
Yeah,
And,
yeah,
the at some point in that consultation, the benefit or the
yeah,
marginal benefit that I'm giving to my client or my patient is gone.
yeah,
And it's just wasting time. And, the big
mm,
problem there is it hurts the business financially, but also
mm,
what about all the other people who are waiting for treatment
Yeah.
that can't get it because I'm over servicing people? If I really want to, like, if I
Mm.
focused on making a difference,
Mm.
then I need to be really quite careful with my time, commercial with my time, to make sure that I can
Yeah.
help the most people possible.
In that commercial sense, Ash, it'd be important to know your KPIs, wouldn't it?
Yeah,
Like,
that's right. And to be very clear on,
yeah,
what appropriate service looks like.
what it looks like, the time
Yeah.
it takes,
Mm,
the perhaps the quality of service within that
mm,
time as well, and sort of, I think I heard you speak about it earlier, like the number of consultations,
mm.
for example, in,
Yeah.
in a day or a week or whatever, because as you
Mm,
said, your biggest number one cost is wages,
mm.
and close second that's rent. So
Yeah.
yeah, important to review your figures. What would you say to sum up, perhaps,
Well,
Ash?
and just on, finishing up on that commerciality thing, it's, that
Yeah,
fundamental thing is, if you want to make a difference in a
yeah,
sustainable way
way,
over the long term, you have to be commercial. Otherwise, you just will not be around to do it.
yeah,
You'll either go broke, or you won't be able to deliver the appropriate level of care sustainably, or,
yeah,
it's just so important to be commercial in what you
yeah.
do. Um, and so, but look, to sum up,
Mm-hmm.
there's quite a lot involved in these businesses in the healthcare industry. You have to
Mm,
have a really, you know,
mm.
high level of training, high level of knowledge in the work of the business.
Yes.
But then there's all these other hats that
Mm,
you have to wear, and
mm.
you know, it, you're not guaranteed success.
Yeah, and it's important to understand, I think, what you're good at and what you're not, and and to seek that external help when you need it. And I know, for example, with yourself, you'll be consulted about, monthly catch up, monthly board meetings,
Mm.
services like Ash with payroll. Would that be right?
Mm.
The
Yeah, that's
bookkeeping,
right. Yeah.
the profit and loss, the financial statement preparation, and what about all the tax compliance that comes around
Oh,
with
yeah.
that? So
Mm.
that's just a given, isn't it?
Oh, look, it is. And, you know,
Yeah.
what I can say is that over the years, we've worked with and seen a number of people
Hmm.
in this industry do phenomenally well.
Do well.
And
Mm.
through that has come, or that's come through them sort of recognizing that
Yeah.
the skills that they need to go to that next level are
Yeah.
different than what got them there, and
In the
are
fir-
different to what makes them a good clinician. And so,
mm.
fundamentally, the entrepreneur,
Hmm.
if they can identify what new skills they need
And
and
learn them.
set about learning them, then
Yeah.
they can really go far. They can
Yeah.
create amazing businesses.
And be successful as a business owner.
Mm,
That's right. Yeah. Yeah.
mm.
Now, well, that's been fantastic today, Ash. What should anyone listening to this or reading this, what should they do if they needed help from yourself or the team?
Oh, I think everyone knows what I'm going to say. Get in touch.
Get in touch. Yeah. Well, we'll put your email and the
Mm,
details here. And certainly, yeah, reach out to Ash and his team here at Sky Accountants if
mm,
you particularly need, I would say, specialist help in this health area, because that's what Ash and his team do have, is years and years and hours, Ash, of help and special advice with health professionals. That's where the niche is at there. So, well, thanks for your time today, Ash. That's been fantastic, and yeah, we look forward to the next episode.
Thanks, Jane. It's been great chatting.
All right, all the best, mate. We'll speak soon. Yeah,
Bye.
bye.